a drop full of the long history of India. I have been here on and off for a little over 10 years. And in that very short period of time, I have seen the great strides that have been made in India in protecting and restoring vision and sight of the many people in this country who need eye care services. I would congratulate India and the government of India on the successes in assisting people who treasure their vision. Thank you. I would also thank the government of India and Indian scientists, many here tonight, for your support toward enhancing the life of science globally. India science is part of a fabric of science that stretches across the globe, and the meeting that we have just concluded attracted vision scientists from some 27 countries. I would congratulate the government of India on that. Professor Natarajan, I have known you only a short period of time. You are an irresistible man in many dimensions, and I wish you well as the editor of the Indian Journal of Ophthalmology, dealing with all of the people who submit their papers and want immediate acceptance. And I suspect that you're a little more difficult with them than that. When we think about research, we think about the future of eye care. What we now practice with our patients was experimental only 20 years ago and 50 years ago and 100 years ago. In our country, and undoubtedly the sentiments also are from many other cultures, it is said, give a man a fish and feed him for a day. Teach a man to fish and feed him for a lifetime. I think we could alter that statement and put it in the context of Professor Natarajan's new goal, his new drive, his new initiative with his work in eye care to extend that into research. And I would congratulate you on your motives for doing that, because the research that you will be doing, among other things in diabetic retinopathy in the slums of Mumbai, will in fact pave the way for the treatments of tomorrow. Thank you, and I join with everyone here in congratulating John and Professor Natarajan again.
Thank you, sir. We as Indians, I think all of us know the Honorable Minister. He, for those of you who maybe have a very brief idea, as far as we are concerned, I think he is so extremely well-read. I mean, leaving aside all the politics and everything, he is an extremely well-read person, and believe me, I think he can question any ophthalmologist in the room about the treatment modalities that they would suggest for anything. So it's our really a big pride and privilege for us to have him with us, because being in the position of power, apart from that, his knowledge and his ability to interact with people on their level is something that is really special to him. And I would really like to thank him for taking time off from his extremely busy schedule to be with us today. So may I request you to please address us.
We share the same birthday.
Yes. Dr. Natarajan ji, Dr. Gyan Prakashji, Dr. Paul Siving, Dr. Rajvardhan Azadji, Dr. Rajiv Mohanji, Dr. Radhikaji, the family of Dr. Gyan Prakash, ladies and gentlemen. It is my proud privilege to be present amidst the galaxy of accomplished doctors to confirm the first Prof.N.S.Sundaram and Mrs. Kamala Sundaram Endowment Award on Dr. Gyan, which is called John Prakash. I congratulate him for getting this, the first award which Dr. Natarajan has started in the memory of his father. Aditya Jyot Eye Hospital was established in the year 1990 by Dr. S. Natarajan at Dadar, Mumbai, and has now expanded into 4-storied hospital. I am told that Aditya Jyot Eye Hospital is the only hospital in India to be full member of World Association of Eye Hospitals. My association with Aditya Jyot Eye Hospital is a decade old when, as Chief Minister of Maharashtra, I inaugurated this hospital, and it is a matter of pride for all of us that Aditya Jyot is providing a comprehensive eye care, including all super specialties, a physician diabetologist, a dietitian for our all benefit of patients. In fact, you see, when I inaugurated, I must say here, when I inaugurated his hospital, subsequently I became the patient of the hospital. So that is very important, and thereby I was knowing more and more, you see, the science on this eye, you see, right from the age-related macular degeneration to the blind things. So which injection is new, which is modern, when it should be applied or when not to be applied, which is costly, which is not costly, and very rightly Dr. Paul has made mentions of the Government of India. We are looking forward, you see, into getting, you see, the cheapest injection, particularly for the age-related macular degeneration, to supply to the poor people in this country. The Aditya Jyot records more than 27,000 vitreoretinal surgery, all eye disorders from the routine cataract, glaucoma, squints to ocular trauma, diabetic retinopathy, and facial plastic surgery. Neuro ophthalmology are treated here with complete professionalism. Dr. Natarajan, a third-generation ophthalmologist, counts his father and grandfather as his mentors in shaping his life, shaping his future. And is very rightly mentioned, and taking a point of that, Dr. Gyan Prakash has also mentioned about his parent, those who have given him a legacy to perform the best of the doctorship. An endowment award and a public lecture in the name of Professor Dr. S. Natarajan, beloved father of Professor N.S.Sundaram and Mrs. Kamala Sundaram. Kamala Sundaram was passed away last year, has been instituted. This award recognizes people with extremely exemplary contribution in any field of science of education that helps elevate the sufferings of humankind. Professor N.S.Sundaram, a second generation of ophthalmologist with more than 50 years service in the community, has helped thousands of people to get vision. Professor Dr. N.S.Sundaram continues to work at 84 years as rector of Aditya Jyot Institute of Optometry. He has performed over 30,000 cataract surgeries individually for the poor and organized more than 1 lakh surgeries, refraction for 2 to 3 lakh people, and conducted more than 200 camps. He is credited with starting 9 special clinics in various segments like cornea, lens, retina genetics, UA, orbit, and for laser in the government hospitals in Tamil Nadu. A special clinic on genetics was the first of its kind introduced by the government of Tamil Nadu. The education has been close to his heart, and to create awareness about eye and eye diseases, he has conducted several eye exhibitions in Mumbai and Tamil Nadu. Mrs. Kamala Sundaram was the pillar of the family. Like any other Indian woman, she had the right blend of support and sternness to nurture her family. However, one thing that set her apart was her grit, courage, and ability to embrace the life. After 3 strokes, she was confined to the wheelchair. In spite of her physical challenge, she was actively involved in the hospital activities and even served as counselor for many a patient disabled with loss of vision. I was fortunate to meet her while she was contributing to the development of Aditya Jyot Hospital. The today's awardee, Dr. Gan, that is John Prakash, presently holds the distinguished position as Associate Director of International Program at the National Eye Institute, the National Institute of Health, USA. Dr. Prakash, with his unique blend of Indian origin and American education, believes that the advancement of the humankind depends on collaborations that are mutually beneficial. He is instrumental in bringing together the diverse researchers, the scientists, and clinicians from various ethnic and cultural backgrounds for greater goods of the mankind. His efforts have resulted in several projects aimed at redressing the sufferings of people in diverse countries of the world. We are proud to have Dr. Prakash with us today and accept the award. I am sure that Aditya Jyot Hospital and its staff will continue to grow all around in the field of eye care and will provide a treatment to poor and the needy under the able leadership of Dr. Natarajan. I wish Dr. Natarajan, Dr. Prakash, and everyone present in the hall a very happy Diwali, and those who celebrate probably the American doctors, they will be going during the period of Diwali, but however, it is our festival of India. It's supposed to be the bringing the lights, bringing the brightness in the life of individual, and that we celebrate after 2 days. May you all give vision to the people to see all the brightness of life and illuminate their life like the lights of Diwali. With these words, you see, I only request Dr. Natarajan as that he recognizes, he has always been going outside the country and attending the conferences and particularly presenting his papers. Sometimes I happen to read, you see, what he presents. And I think, you see, his mind, his activities, that shows, you see, the entire hospital, his hospital is, I think, is working